Ambulance is the best way for transport in a metro city. Every minute is very important in stroke, both in cardiac and brain.
So we should start this awareness from schools. Mainly once children are educated, elders definitely we have to educate. But the next generation, maybe 10 years from now, 5 years from now, when we look at it, we should not miss even a single stroke.
Yeah, there is definitely a change, and the prevalence of stroke in women is slightly higher than in men. It is mostly attributed to their longer life expectancy. Women, as we all know, they live longer than men.
Every stroke begins as a silent short circuit in the brain, sudden and often without warning. What determines survival and recovery isn't just luck. It's the speed of response and the precision of medical science. With advanced neurocare and a multidisciplinary approach to recovery, stroke doesn't have to be a life sentence. It can be a turning point. In today's conversation, we're joined by two leading neurospecialists from Kauvery Hospital's Marathahalli, who will delve into how medical advances in neurocare are not only saving lives, but helping Bengaluru reclaim its rhythm, one saved neuron at a time. Joining me today is Dr. Tejas M. Rao, a senior consultant in endovascular neurosurgery and spine intervention at Kauvery Hospitals. Dr. Rao is known for pioneering minimally invasive treatments for complex brain and spine conditions. Also with me is Dr. Abhilash Tadibonia, consultant neurologist whose expertise lies in the realm of acute stroke management and neuro rehabilitation, which has helped redefine recovery pathways for patients. Thank you, both of you, for joining us today.
Thank you.
According to the World Health Organization, annually 15 million people worldwide suffer a stroke. Of these, 5 million pass away, and another 5 million are left permanently disabled. India records a brain stroke every 20 seconds, it is reported, amounting to around 18 lakh cases, new cases each year. Yet public awareness is about prevention specifically, and timely treatment remains low. Let me start with you, Dr. Abhilash. How has our definition of stroke, what it comprises, changed in the last 10 years?
As you rightly said, stroke is still the second most leading cause of mortality worldwide, not just in India. So basically, the stroke was first defined by Hippocrates in 400 BC. He called it apoplexy. He didn't put a term stroke, he called it apoplexy to whatever that starts on a sudden basis. So till late 17th century, they still called it apoplexy. In the late 17th century, Dr. William named it stroke for the first time. He said that when there is a sudden onset weakness of one side of body, you call it stroke. From that, there is evolution very gradually till the past 40, 50 years. In the past 50 years, we have added, it's not just about the weakness of one side of body, we have added something like it is also associated with speech disturbances, vision disturbances, gait and imbalance. We have added all these things in the past around 4 decades or 5 decades. So more or less the definition has remained same in the past 40 years. It includes sudden onset weakness in the body or speech deficits, eye deficits, or any imbalance issues. Okay. What has changed much in the past recent time is the timeline. How fast should a patient come to hospital and what we can do when he comes in the right time. So these timelines, there is a drastic change in the recent times.
Dr. Tejas, we see a lot of medical advancements happening, of late. There's something being reported about every day. So in a scenario like this, what does treatable or what has treatable come to mean in today's neurology, where stroke is concerned?
So continuing to what Dr. Abhilash just said, so stroke is not, all strokes are not the same. So broadly you can divide it as minor strokes or mild strokes or a severe form of strokes. So with the advent of neuro interventions, especially the imaging MRI, so we are able to recognize more severe strokes. So the treatment is not same for everything. Okay, milder strokes usually earlier it used to be they used to recover very well with physiotherapy, rehabilitation and all. But the severe form of strokes where the large vessel is involved, it requires more advanced treatments. That has evolved over years, which was not there before. So the mortality rate used to be high earlier. Now it has reduced because we are able to recognize these things, and with the technological improvement, the treatment has also changed.
Okay. Ischemic stroke is the most common type of stroke in India, and mechanical thrombectomy has emerged as a novel technique that has transformed our outlook towards stroke, turning it into a possibly reversible event, right? Uh, but a lot of people don't know the complexities of what it is, and also there's in the medical fraternity, if I can say, there's been this debate about who should be or should not be administered a medical thrombectomy and who will it benefit the most. So what is its real world impact? Either of you can answer this.
Thrombectomy, thrombus is a clot, ectomy is removal. Thrombectomy is removal of the clot. When there is a ischemic stroke, the basic pathology is that a blood vessel is blocked by a clot. So basically, we are removing it by some procedure. We call it mechanical thrombectomy. We do the same thing with an injection, which is less effective compared to this. That is called thrombolysis, where lysis is breaking the clot with an injection. Here we are actually going into the blood vessel. We are catching up that clot and trying to retrieve it back. This is called mechanical thrombectomy. Uh, there are timelines for who are eligible for this procedure. Okay. Earlier, it used to be like 6 hours, and then we have extended it till 9 hours in some particular cases. Then there are some research articles which tell we can go up to 12 hours.
This is from when the symptoms
Start from when the symptoms start. And with advanced perfusion techniques, with advanced imaging techniques, we can extend it till 24 hours is what the newer guidelines are telling. Once there is evidence of there is brain that you can still save, we can extend this procedure till 24 hours with the help of some recent advances.
Okay.
See, mechanical thrombectomy is it should not be made complex for general public. You are just fishing out the clot. Okay, the clot which is blocking the vessel, you are clearing it out. That is the simple way of describing a mechanical thrombectomy. So, what will happen when you are clearing this clot? The brain's blood flow is restored. So, oxygenation to the cells which are still preserved, which can still survive, is restored. So, when we are doing this mechanical thrombectomy, the recovery is better. That is what is mechanical thrombectomy. And coming to the second part of the question, who has to do it and all, ultimately it should be a good treatment for the patient, and it has to be done at the right time. Whether it's an emergency physician who is doing the injection, or a neurologist who is giving injection, or who is doing the procedure, everything is for benefit of the patient. So the question of who is doing it doesn't come. It should be beneficial to the person who reaches the hospital in time.
Right. Okay. How does this differ from open neurosurgery?
This considering stroke as such. So earlier days, stroke means that area of the brain is already gone. We used to do what is called as a decompressive craniectomy, means removing the bone. That is basically to give space for the brain cells to expand outward into the atmosphere. If this is a closed space, skull is a closed space. So anywhere injury in the body, there will be swelling. So that will start compressing the centers which are responsible for our heartbeat, for the breathing centers. So to prevent and to save the life, we used to do it. This comes in the later part of the stroke management. So when the patient reaches hospital in hours, so that's when the surgery is not encountered there. It's mainly the thrombolysis or a mechanical thrombectomy. That's what will be done. So surgery doesn't come into picture in the earlier hours of stroke.
Okay. It's interesting you mentioned that, because seeking medical attention within the golden hour, that window, which is said to be 4 to 6 hours after symptoms begin, is said to be crucial for minimizing damage and maximizing recovery. But why do most patients miss that window? What happens, do you think, that makes them believe that?
See, the main, so we have two acute events which bring patients to hospital. One is heart attack, the other one is stroke. Okay. What is the difference between these two, you should understand. In heart attack, you have pain associated with it. So that's when patient will immediately come to the hospital. But in stroke, there is no pain associated with it. So that's when they start analyzing, is this weakness acute? Am I going to improve without this? Is it? So they don't reach hospital in time. That is the main thing. So first thing is patient education. That is more important. So don't wait for the symptoms to increase, and don't analyze yourself. First reach hospital.
Yeah, and also a lack of awareness of what is exactly a stroke. They just think only weakness of one side is stroke, but there are many things to it. It is not just sole weakness. Also, sometimes most of the strokes that happen are during the nights, during sleep when they are sleeping. So they wake up, they notice that there is something, not normal, and they go back to sleep. They'll think we can go to hospital in the morning, but it is already late when they come back in the morning. So that we often encounter around what we ideally tell is you come to hospital as soon as you notice the symptoms, ideally within 4.5 hours. The average time that patients take in India to come to hospital is 11 hours. So it's way beyond what we can do. And also the problem of commuting. What the attenders feel is that they can drive the patient to a hospital nearby or they can drive. But no, ambulance is the best way for transport in a metro city. Definitely, it is going to take 50% shorter time if you travel by ambulance than by car. Every minute is very important in stroke, both in cardiac and brain. Minute is what we call as time is brain. If you lose time, you lose brain. So commuting is very important thing, patient education is very important thing, and do not neglect symptoms. As soon as you notice them, rush to a hospital which can handle all A to Z of stroke.
Okay. Can you dwell a little more on what, like you said, the attendee, whoever is with the patient, so tends to be the family, right? So what they can do, because sometimes when things happen to you, because you're so intuitive about your own body, you tend to ignore it. But are there visible signs that families can sort of pick up on and say, let's get this done? Is there something that can help bystanders and families help with getting people to the
When they notice the symptoms even any hour of the night, they have to come to hospital. Symptoms are simple. Weakness is obvious, hand or leg weakness. They're not able to sit, not able to walk to washroom. What patients tell is they wake up in the night to go to washroom, they're not able to walk, they just fall down on the floor, and they're there on the floor all night. Morning someone notices and gets them to hospital. So weakness is one obvious thing. Speech difficulty, slurring in the speech, and difficulty in balance and vision complaints, all these attribute to stroke. Attenders should be very watchful for these symptoms, especially in the elderly. So when they notice this, don't waste any time, rush to the hospital.
Recently, we had a patient who came purely with vision issues. One field of the vision is gone.
That was the only symptom.
That is the only symptom. No weakness of hand, no weakness of leg. The speech is also normal. So they should be aware of all these symptoms. The stroke, whichever part of the brain it affects. So the symptoms will be based on that. Okay. So even minor symptoms, they should not ignore it.
Even when we talk about awareness, some people study about it, maybe it's taught in schools, but a lot of people do not know, like even the Be Fast mnemonic is not very well known. Do you think awareness itself, we need to do more to make people aware of these symptoms, like take it to all the corners of this country? Do you think awareness campaigns itself are not enough?
So we should start this awareness from schools. Okay, mainly once children are educated, elders definitely we have to educate. But the next generation, maybe 10 years from now, 5 years from now, when we look at it, we should not miss even a single stroke. That's how we have to reach. So the education should start from schools, and of course, elders also community health. We should reach out to the apartment, the people. We have to educate them about Be Fast.
All right. Okay. Let's speak about stroke symptoms in women. It said that they appear differently, or do they? Do they manifest differently? And are there ways that depart from how it would, crop up in an otherwise healthy woman who's does not have any hormonal issues, or maybe is not pregnant or is not in a postpartum phase? How is that different?
Yeah, there is definitely a change, and the prevalence of stroke in women is slightly higher than in men. It is mostly attributed to their longer life expectancy. Women, as we all know, they live longer than men. So strokes are more common in old age. So when they live longer, they have strokes. Not just that, pregnancy. Pregnancy is a state where they have many changes in the body, hormonal or physical or physiological. These things can cause BP, strokes, all these things. Okay. So there are some physiological changes in the body during pregnancy. Suppose you say it is a pregnancy is a stage of procoagulation. That is, they have the tendency to form clots in the body. Their blood will become thick. So that start forming clots in the blood vessels in brain, and that causes stroke. Second, we call something called eclampsia of pregnancy. That is, the BP shoots up due to some physiological changes in the body. That is also a severe risk factor for the stroke. Not just that pregnancy, also the usage of oral contraceptive pills, okay, and estrogen supplementations, hormonal supplementations, hormone replacement therapies in the elderly women. All these supplements, especially estrogen, they cause this procoagulation tendency. The blood becomes thick and it start forming clots everywhere. Okay, not just the brain, everywhere in the body it can start forming clots. And of course, stress is one thing from what they face. And also, the incidence of obesity is more in women compared to men globally. Okay, obesity is a very big risk factor for stroke. And I also feel that there is some kind of social stigma regarding strokes in women that is often neglected. They are not taken to the hospital in right time. They are not receiving proper treatment at our, tier 4 hospitals. So there is definitely a increased prevalence of stroke in women because of multi factors.
Just adding to what he told, so metropolitan city doesn't matter. When we go just outside this city, so it is like women symptoms are they themselves neglected. So it is like man is the breadwinner of the family. Any symptom they reach to hospital in time. But if it is a woman, they'll try to postpone it. So this is what happens. So of late we are not seeing it in metropolitan cities, but if you go just outside the circle, you are able to see such reasons why women don't get treated in time.
Right. Let's move to neurocritical care and post-stroke recovery. What happens after the clot is removed or a surgery is done? What then for the patient?
Okay, once we remove, the main idea of removing the clot, that is mechanical thrombectomy, is to restore the blood flow to the brain. So the oxygenation automatically improves. So from the time the stroke has developed till the time we remove the clot, so there will be multiple cells, as you had mentioned, will keep dying. So by the time we remove the clot, there will be some cells would have already not functioning, and we are preserving the cells which are having the tendency or going towards the deoxygenated state. So once we remove the clot, the oxygenation improves. Okay, so it all recovery depends on the pre-procedure, how we have a coma scale. So based on it, how it is, and there are several scales. We will get to know what the condition was before the procedure, after the procedure. So based on which we can roughly get to know what may be the ICU stay and all. It's very difficult to predict these things, but we'll get a rough idea probably how will this patient do post procedure.
Okay. First 48 hours post procedure is crucial. We do something called neuro monitoring. We watch him very close the first 48 hours. After that, most patients will recover, and whatever the residual weakness or deficits that they are having at the end of 48 hours, they need good rehabilitation, some kind of physiotherapies, rehabilitation in the sense also for swallowing, speech, all these are included.
I know it's different for different patients, but give me a sense of how soon can people go back to quote unquote daily life? Because also you can address that. Does daily life mean different after a surgery? And how the normal definition of daily life, does it change? And at what point do you think, like a ballpark figure of what point do you think it could come back to normal?
As you rightly said, it differs from patients to patient. It also differs from the location of stroke, because everyone doesn't have stroke in the same location. There are many places in our brain, many lobes. Okay. There is something called the brainstem. It is a very critical place where the neuron density is very high. Every cell is crucial. If there is a stroke in that part, the time for recovery is going to take long. Or if it is in other lobes, the time for recovery is short. Okay. So there is no hard and fast rule for everyone like they'll recover in this time. But it can vary anywhere between less than a week to a year to an year. So with a successful procedure, if it is done in the right time by the right hands and the flow is re-established in the right time, we can say the patient can go back to his normalcy within a week. That is there. So it basically depends on two major factors: speed and accuracy. Speed, how the patient comes, how accurate the procedure is done. Just like mathematics, what mathematicians tell, speed and accuracy are two eyes of mathematics. The same thing applies here in the biology as well. So it's just the time we are doing it and how good we are in the procedure. That decides how he's going to be in future.
The ultimate aim of any stroke management is to bring back the person to independency. Okay. Whether can we define what is getting back to normalcy is what you asked. Normalcy is very difficult. So what was his profession before, intellectual job or labored job. So it depends on that. But aim of any of these procedures is they should be independent. They should not be dependent on someone else. That's what our aim is. Beyond that, whatever recover happens is a blessing.
What is the future of stroke care in terms of new studies and advancements in tech, medical tech also? What is something that you're looking forward to that you believe will help patients, and where do you think uh, stroke care and research on those lines is headed in the next 5-10 years?
See, the field of stroke is rapidly evolving. The past 2-3 decades, we have seen newer imaging techniques, newer diagnostics, newer therapeutics, newer drugs, and newer methods of rehabilitation. Everything is new in the past 2-3 decades, and it is rapidly evolving. At the same time, there are multiple studies going on what we can do to benefit the patient. And with the AI kicking in, I'm not telling that it will replace the doctors, but it will help as an aid for us to better understand how it is. See, if patient comes with a stroke, we see him, we know, and we feed it to some system or some software. And with machine learning over the course, it will tell us how the patient is going to respond. It will also tell us the patient, is he eligible for a particular procedure? How is he going to be after this procedure? Will it help him, or the risk is more than benefit? All these, can be learned by machine learning and AI. So that is what we are looking at, and I feel that there is no complete replacement for doctors, but it will be as an
Yeah, I mean, it is a bit contentious. Would you want to weigh in on that? AI and maybe robotics, where you see the use for it?
Thing is, the advancement, whatever we are seeing till now, what we are going to see in the future, mainly it is about the right treatment for that time when he has reached hospital and the accuracy of the treatment. This is what our aim is to improve these things. So step by step, whatever advancements are happening in medical field is mainly for the accuracy and the right treatment which has to be done at the point when the patient comes. Definitely AI will add to it. So coming to robotics, very primitive stages the researchers are going on. So mainly it will be useful for the radiation exposure for the people who are treating the patient. Apart from this, there is something called as telerobotics, means if the patient is in some center, so they will reach the nearest hospital where they may have all the technologies, but the treating person may not be there. Okay, so we can sit in a different center and we can do the mechanical thrombectomy, which will benefit the patient. So the time will be saved coming from one center to the other. So still long way to go, but if it comes, we can treat the patient wherever they are. They just have to reach the nearest hospital. We will be able to help them.
What are your closing thoughts, about what every Bangalorean needs to know about stroke management and stroke care? If there's one thing that you would want to tell them, what would it be?
In stroke, I just want to tell one thing: be fast and all. Everyone is aware of it. So don't analyze, just act. Reach hospital in time. If you start analyzing, you are losing time. That's what I want to tell them.
Yeah. once you notice the symptoms, there is no waiting. Doctors can wait, but the brain won't wait. It start dying. Every minute is important. Time is brain. So you rush to the nearest hospital as soon as you notice some symptoms of stroke. Don't delay.
All right. Yeah. Thank you.
Okay, thank you.
Stroke doesn't end at survival, it's where a new journey begins. From the high stakes decisions made in neurocritical care units to the steady steps of post stroke recovery, every moment counts. Knowledge can become instinct. So, know the signs, act fast, and share this video with a friend, family member, or a loved one because stroke stops here. Thank you.